Listen, I'm so excited to talk with you all again. A lot of familiar faces here, some new faces. And before we get into this lecture on sleep, which is literally the most important thing we could all be doing right now, I wanted to talk a little bit about just a little bit about something I saw in the paper. And so I just want to share it all with you and show you what was in the paper and maybe just talk about it very briefly, before we get started. And I'll hand it over to Dr. Laura once I get off my soapbox here. So in multiple papers, Wall Street Journal and the New York Times was this advertisement, and I'm not sure if anybody saw it. And we are getting questions on this nonstop, so I wanna talk about it. Do you all see this window here? This advertisement from Eli Lilly. So this advertisement is about obesity, and I have never seen in my life. I've been in healthcare for 20 years now, and I have never seen such a push to make, to reach people who are having trouble with weight. I have not seen it, maybe since Weight Watchers. It was popular in the early 90s. So, and I wanted to talk about it because I feel pretty strongly about this. And on one hand, there's these two new drugs, and I'm sure you all have heard about it, Ozempic and Zepbound, right? Or Mounjaro and Wegovy. Those are the names. And so on one hand, these are truly medications that are different than medications we've had in the past. They have bigger studies than we've had in the past. But if you look, they're spending a lot of money, these companies, to reach people who need help, right? Who really need help. And they're making it as if you look at it at first glance, this Eli Lilly's advertisement, they're trying to make it like they're a beacon of hope, right? And it's promising you a simple solution, right? Take this drug and the weight will come off. And not only will the weight come off, right? It's not just about weight, it's about health. And the problem is, in my mind, it's not necessarily about the drugs. The drugs are better drugs than we've had historically with larger studies, but it's the messaging and a little bit of a false narrative. Like this narrative is really alluring. People want, a quick, easy fix for something that is actually really, really complex, right? And we all know that this is complex, that it's not just about overeating and willpower, right? It's not, it's a really hard, multifaceted. And one of the things we're going to talk about, we know it's about hormones. We know it's about the carbohydrates in your food. We know there could be psychological issues, binge eating, food addiction. We know it could be sleep, okay? But the problem is me telling you to sleep 2 hours more, it doesn't make trillions of dollars like these drugs do, right? These may be the first $1 trillion drugs, right? It doesn't make you beholden to me to tell you, hey, actually 1.5 hours more of sleep a day will naturally, spontaneously make you eat less. You'll eat about 300 calories less, and Dr. Laura will talk about that. And you'll be less hungry. You will literally make less hunger hormones. And this advice was true when your grandma told you probably should get more sleep. And it's even more true now. But the problem is we don't profit off of that. And there's a big profit engine, and that's why there's a newspaper article about this drug and not sleep. Because that drug is, while it's a good drug historically compared to other drugs we've had, right? They're trying to make you think that this is a drug deficiency when it's not. Not to say it can't be a tool, right? I'm not saying that. It's just not exactly it. not the simple solution. And I don't just blame the companies. Actually, I think the companies in this case have done a fairly good job of bringing to market a pretty good drug, right? I think the problem is us, the medical doctors, that we're so fixated on giving people, for years in obesity, nobody talked about hormones. Nobody talked about sleep. Nobody talked about stress. Nobody talked about processed food. The easy things that we all know, matter so much. We all know, right? We know that getting a good night's sleep will lead to better choices the next day. We all know it's going to make it easier for us, right? We see in our kids. Our kids don't get a good night's sleep, right? I know what they're asking for the next day, right? So all of a sudden, a lot of doctors care about hormones, right? And they're all looking to sort of become people that care about people with obesity, and I suspect some of them do. But I think that the medical profession is just fixated on drugs. And again, not to say that the drugs don't matter, but we've known about insulin, leptin hormones, the ghrelin hormones, right? And how they affect hunger and fat storage, right? We've known about this. And yet for the last 50 years, they told you to count your calories. And now all of a sudden, we have this drug, okay? And it's about your health. And all of a sudden, it's not that willpower and count your calories nonsense. We sold you because we have a drug now. So, just to get off my soapbox here a little bit, I think there's a problem here, and the potential for all of you, and everybody in our company, our families, to be offered drugs when sometimes the simple things right in front of us, like, hey, put the phone down and try to get some sleep. Put the phone down and try to get another hour and a half of sleep. And Dr. Laura is going to talk about all that and talk about all the science, because she's much smarter than me, right? Me and Dr. Laura, we're both board certified she's board certified in family medicine. I'm board certified in internal medicine. We're both obesity medicine certified. We're both metabolic health practitioners. I'm a personal trainer. She's a, states tennis champion. This is what we live for. And what we live to do is really get people to not need meds, and not to say we don't encourage meds when they're needed, because we do. So I'm going to get off my soapbox. I don't want to take any more of Dr. Laura's time. Guys, if you have questions, put them directly into the chat, okay? And we'll talk about it. Put them directly into the chat, and I promise we'll address it as time goes on. And with that said, if anybody has questions about these medications, you can direct them to me and to Dr. Laura. If you have questions about sleep, again, you could, Dr. Laura's a lot smarter than I am, but you can direct it to either one of us. You can use the app, which is free to you all, to sort of interact, and you can ask some of these questions there if you care to. And with that said, Laura, I'll let you take over.
Today, we are going to be talking about, like Tro said, how important sleep is for optimal health. We spend 1/3 of our lives sleeping. So you don't want to underestimate the importance and power of something you're meant to do for 1/3 of your life. It makes sense that we train for our hobbies, our work.
Dr. Laura.
Excellent at them. And I think it's important. Let's think about becoming sleep experts, because there's actually not probably any other single activity that you will spend more time doing than sleep. We're going to first talk about what is sleep, then its role in our health, then practically how can we improve your sleep, and go through some frequently asked questions. Broadly speaking, sleep keeps you alive. Humans can't function without it. It's actually an extremely complex process that we won't get in too much depth about, but hopefully as you better understand kind of the types and stages of sleep, you'll be motivated and feel like you're more empowered to actually make it better. And there's two basic types of sleep: REM, or rapid eye movement sleep, and non-REM sleep. And forming memories requires both of these stages. Stages of non-REM sleep include stage 1, and this is right as you're going off to sleep. Lasts is about 5% of the whole night. Your eye movement starts slowing down, your muscles relax. Sometimes you might realize your muscles twitch or you almost jerk awake for a second. Stage 2 is where you spend the bulk of your sleep. It's a very light stage of sleep. Your muscles are further relaxed, your body temperature is dropping, and your eye movements stop. Stage 3 is that deep sleep. It helps you feel refreshed in the morning, and it occurs for longer periods of time during the first half of the night. If you wake up during this stage, you might have sleep inertia or brain fog and feel really groggy, kind of out of it for 30 minutes. And just a fun fact, the body produces most of its growth hormone during this stage. The exact amount you'll get will vary a little bit by age. And then with REM sleep, it also is about 20 to 25% and occurs typically around 90 minutes after falling asleep. And they call it rapid eye movement because your eyes are literally moving rapidly from side to side. This is where most of your dreams occur. Your arms and legs, and you're actually temporarily paralyzed, so you cannot act out your dreams. And interestingly, the initial cycle might only be 10 minutes early on in the night, but then as the night progresses into the early morning hours, you have more of this REM sleep, and it can last up to an hour. Also, your brain's metabolic activity will increase by about 20% during REM sleep. When you progress through all stages of sleep, that's one sleep cycle. And so typically you'll go from stage 1 to 2 to 3, back to 2 to REM, and then either stage 1 or 2. You might briefly wake up, or you might just transition to 2 and 3. You can actually go back from 2 to 3 to 2 to 3 during the night, so it's not precise, and that's more likely to happen earlier on in the night. The average person will get 4 to 6 sleep cycles per night, lasting about 90 minutes, but it can actually go from almost 1 to 2 hours. And some people will tell you they know what their sleep cycle length is because it's not uncommon that you wake up at the end of a sleep cycle. And usually you will drift right back to sleep, or you won't even remember that you woke up. This is something you might see if you have a sleep wearable or have seen a polysomnography, where you can actually see you go from a wakeful state down into the first stage, and then you might kind of jerk back awake and then go back to sleep and progress to stage 2, then to 3. Again, you might have some back and forth potentially, and towards the end of the cycle, you'll go to REM sleep before going back to stage 1 or 2. These were just some really interesting sleep statistics that I found as I was reading about this more. 35% of adults suffer from sleep restriction, which we define as less than 7 hours per night. 50% of adults report feeling sleepy during the day, anywhere from 3 to 7 times per week. The annual cost of workplace errors and accidents linked to insomnia alone, so not other sleep issues, is $30 billion. 11 days of work are lost per year from someone if they are suffering with insomnia. And depending on the study, up to 30% of people have insomnia. Drowsy driving is responsible for 6,000 fatal car crashes every year. And this one was really surprising to me. 1 out of 25 people have fallen asleep in the past month while driving. This important really for parents. 57% of teens who use technology in their bedroom have sleep problems. So knowing how important sleep is, which we'll learn more as this presentation goes on, really think about getting the electronics out of your kids' bedrooms, including cell phones. With that, let's talk a little bit more about its role in our health. So sleep is a process through which your body rests and recovers. It cleans and repairs cells. It helps form memories, organize information in our brain. Sometimes you'll hear people, they go to bed with a problem and they wake up and they've solved it. It helps you process new information, refills your emotional battery, and a lot more. And you've probably heard a lot about these things already. I want to, on the next slide, give you an example of the physiology and how complex it can actually be. And I'm going to just highlight how the brain actually cleans and repairs itself during sleep. So there's something called the glymphatic system, and this is where the brain replenishes and cleans itself. It will actually remove metabolic waste products that accumulate during the day during this state of sleep. The vast majority occurs during sleep. So again, the clearing of waste from our brain happens when we sleep. So we don't want to sleep deprive ourselves. It actually allows our body to clear tau proteins, amyloid beta plaques that are associated with dementia. And stage 3 or deep sleep has an 80 to 90% increase in the lymphatic clearance relative to being awake. Some newer studies are actually showing that intermittent fasting, omega-3 supplementation, and even ketones can actually help with lymphatic clearance. I won't have time to go over all of these things, but inadequate sleep is linked to so many things with metabolic health: type 2 diabetes, obesity, mood disorders, including really all psychiatric conditions, cardiovascular disease, arrhythmias, impaired quality of life, kidney disease, chronic pain, increased just risk of death overall. And dementia, there's studies in adults where less than 7 hours is associated with an 80% higher risk for dementia. So huge implications there. Briefly, with metabolic health specifically, they've done some studies where if you sleep less than 6 hours per day, there's a 40% increase in your chance of obesity, as well as type 2 diabetes, hypertension, and cardiovascular disease. And the mechanisms are really complex. There has to do with your body having less insulin sensitivity, more difficulty taking sugar out of the bloodstream, increased stress hormones. Tro mentioned ghrelin and leptin in the beginning, so the increase in those hunger hormones. And they found, which we'll look on the next slide, with sleep deprivation, you have an increased energy intake between 250 and over 350 calories per day just because of less sleep, nothing else. And they also find that people will eat more frequent, smaller, hyperpalatable snacks or foods when they are sleep deprived. And this is something I worked night shift in the hospital, and it's totally anyone who has been on a shift working or had their sleep really thrown off, I'm sure you've felt that decreased willpower, if you will. I don't love that, but it is true. Your brain does not have the same cognitive control to make healthy decisions with sleep deprivation.
Can I chime in on one thing, Laura, here? Just to focus in on this. They recently showed that the entire drive to eat is based on the hunger hormone ghrelin that is increased with sleep deprivation. So your entire baseline, when they reanalyzed the study that you're probably going to talk about right here or coming up, they looked at the hormonal responses, and they found that your hunger hormones literally go up all day long the next day. And not only that, they go up with the same meals, meaning you ate the same thing and your hunger hormones are higher. So sleep deprivation is literally making you hungrier, right? It's making you hungrier. So kind of the opposite of, not necessarily maybe not decreasing your willpower, but driving you to eat, So just wanted to add that in.
Yeah, no, excellent point. And that's what this study here actually showed. So they looked at 12 individuals, and in this study, they actually sleep deprived them to 4 hours of sleep for 2 weeks. And then they gave them a 3-month washout period, brought them back into the lab and let them sleep for 9 hours, and compared those two time periods. And they found with the sleep deprivation, they ate over 300 more calories per day. They gained more weight, and more importantly, they also gained more abdominal visceral fat. So that's the fat that's around the organs that we worry more about. And they controlled for their physical activity and other things. So there was not some other confounding variable in this instance. It really was, like Tro just mentioned, they had increase in hunger hormones that was driving behavior, driving increased intake. Another study showed that if you sleep restriction is associated with a higher BMI. So that's what this graph here is showing. The less sleep you have on average per night, the higher likelihood, the higher your BMI is. And this is for women and for men. And so BMI is on the bottom here. The same thing with sleep variability. Either very low BMIs actually, or again, more sleep variability, having higher BMIs. And Sleep variability refers to going to bed and waking up at different times throughout the week. So we know sleep deprivation causes increased caloric consumption. What about if we extend your sleep going the other direction? What happens? And this, they looked at over 80 people and that had less than 6.5 hours of sleep per night. And they said, let's try to push them closer to 8.5 hours per night and see what happens. And what did they find? The group that increased their sleep had 270 less calories than the control group that continued to be sleep deprived. And on average, for each hour increase in sleep, there's 160 less calories per day. And people reported they were more alert and their moods improved as well. Sleep is also important for cardiovascular health. There's a lot of data coming out about this. One of the big things that sleep deprivation can do is increase our sympathetic nervous system. And that can increase blood pressure, actually impair our endothelium, and so that's our blood vessel lining, and cause damage. And damage to that is then going to increase risk for heart attacks, irregular heart rhythms, and other things like diabetes and other metabolic conditions as well. We won't have time today to talk about sleep apnea, but later on, maybe in the next few months, we'll have a sleep course that will definitely have some information on sleep apnea, which is really important as well. Next, we're going to talk about the immune system, cancer, and mental health, and how sleep deprivation can impact those things. You have a 3 times higher risk for the common cold with less than 7 hours of sleep, 5 times higher risk if you have less than 92% sleep efficiency, and that means the amount of time that you're actually asleep when you're in bed. You have increased risk for higher inflammatory markers, autoimmune markers, and decreased immune response if you get a vaccine. It's also associated with multiple types of cancer, and circadian rhythm, which we'll talk about in just a bit, disturbance is also associated with several different types of cancer. In regards to mental health, there's a ton of studies. This could be its own presentation by itself, but 1 week of sleep depression has been shown to decrease optimism, impair quality of life. Insomnia is associated with a 2.5 times higher risk for all psychiatric disorders. And it's very likely this two-way street where chronic sleep problems affect 50 to 80% of patients with psychiatric conditions, compared to only 10 to 20% of the general population. We just talked about the amount of sleep and how important that is, but timing also is relevant with sleep. There's something called circadian misalignment, which is when the time that you're awake and being awake and the food that you're intaking occur outside of our normal circadian system, when our body would like us to be sleeping, instead we're eating or we're staying awake. And they've shown eating within 2 hours before bed is linked to not only later bedtimes, but difficulty falling asleep, difficulty staying asleep, and higher risk for obesity and other metabolic conditions. Also, if your circadian is not aligned, you have a lower energy expenditure, so your body's not burning as many calories. You'll see alteration in appetite hormones, increase in the hunger hormones, and again, there's the body driving you to make unhealthier food choices. So this study was really interesting. They compared early eating, so having dinner at 3:30, compared to late eating, having dinner at 7:30. And compared to having an early dinner, late dinner doubled the odds of someone being hungry, increased the ghrelin to leptin ratio. So that's, again, ghrelin's that hunger hormone, extremely powerful, and that decreased energy expenditure, decreased the expression of fat breaking down genes, and increased the expression of fat building genes. And they controlled for everything. So people were eating the same things. They were just eating earlier in the day versus later in the day. All right, and that is it. So what questions or comments from anybody do we have?
We have a bunch, and I tackled some of them, but I'll read them out loud so we can sort of discuss them. But I'm going to add amazing talk, by the way, and I'm just going to add just a little bit here. I want to share my screen and make sure you all could see that. Do you guys see this map here? It's from a resource called the CDC, which usually puts out pretty accurate information. Not always, but usually. And you can see here, this is a map, guys. And so this is you all, the Mississippi, Alabama, Texas, Louisiana area. Most of you guys are out there. You can see there's a huge amount of sleep disturbance. And if you look at other maps of similar diseases, you can see it just diabetes and arthritis. You could see, again, it's like almost identical maps. And again, I wish I could market sleep and sell it like Eli Lilly on the front cover. But it's nonetheless, it is truly one of the most important things you can do. So I'm going to read off some of these questions, and maybe you can just tackle them really quickly. I gave my responses, so it'll be good to hear yours, Dr.
Either whether it's insomnia or issues with going to sleep at nighttime, then you do want to avoid daytime naps. Say you sleep 8 hours at night and you also happen to enjoy a 30-minute or maybe an
question. Again, I should be clear. Glycinate for sleep, and I know we're
alternative medications available for. So
yeah. It has some abuse potential. Leverage the sleep. So just an FYI. There's another question here. It's, how do I get a sleep study? You can tackle that. I just said call our office if you're part of our clinic. If you're not part of our program, sign up for our program. You can reach out to Amy at Dr. Tro. Amy will put the landing page to submit, but you can also just ask your doctor, you know.
Treat the iron deficiency. Oftentimes it will halves, and I mean our entire posterior chain down is extremely common now. We sit for the bulk of the of that type of movement will help get blood flowing and help with some of that stiffness, achiness.
Yeah, 100% agree. Drowsy and sleepy, and give you all sorts of side effects, but just simple stuff sometimes is the easiest. And if those simple stuff don't work, then you could turn to medications, certainly. We're coming up on the hour, guys. I want and we're happy to keep bringing you right. So grab a person you care about at work, bring them with you. They don't have to do our program. Just get them to listen, get them to hear, get them to join the app. It is free resource for them. And thank you, Dr. Laura, for the amazing presentation. And thank you all for coming.
Awesome. Thank you.